My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have Sally Welborn, the Executive Director of Advisory Services at EHIR, sharing her 30 years plus of employee benefits and healthcare wisdom with us today. Hey, Sally.
Good morning, good afternoon, wherever we are.
Yes, just getting to the afternoon. So we're really happy to have you. For all of you listeners and viewers that don't know, Sally was formerly the Senior Vice President of Global Benefits at Walmart, the biggest employer in the USA. And Sally's expertise in employer solutions and payer solutions focuses on improving quality, lowering cost, reducing inappropriate care. At EHIR, she guides innovators and members through the ever-changing healthcare landscape. And Sally's influence extends to board roles on organizations like Leapfrog Group, the Penn Center for Health Incentives and Behavioral Economics. I believe you're also on the board of Business Group on Health, if I'm not mistaken.
Formerly.
And we're very excited to welcome you to the podcast.
Thanks, Norm. Good to talk to you this morning.
Yeah, really, really nice talking to you. So, Sally, if you don't mind, walk us through what inspired you to be a part of the healthcare space.
So I wish I could say it was inspiration. That would sound much better than the answer I'm going to give you, which is I started out in employee benefits many, many decades ago, more than the 30 years. And as one in consulting, and in those days, when you thought about employee benefits, everyone thought about pension plans, and the medical benefit was just sort of just out there. It wasn't a big deal.
Mm-hmm.
And as healthcare costs continued to rise, and as employers continued to have to look for ways to manage healthcare costs, it just brought the consultants along. So my early years were in the consultants, and so it just forced us to have to focus on more on how to influence rising costs. I mean, we've talked about healthcare cost containment since since mid 80s. We've been talking about healthcare cost containment, and so almost by brute force, we were all employee benefits consultants were brought forward into healthcare is a number one thing. And I've always just been focused on strategic ways to manage healthcare costs as opposed to the more tactical ways of shifting costs.
That's fantastic. So kind of walk us through, you were at Wells Fargo for a little over 11 years, and then in 2009, you joined Walmart as their SVP of Global Benefits. You were responsible for overseeing global benefits across 28 countries, more than 2.2 million associates and family members. Kind of walk us through that experience and some of the successes and learnings from that time.
Yeah, well, I think that having a platform like that is a privilege and an honor, and having the opportunity to influence that many people, because it's that many employees, and also if you think about their family members, it multiplies by 2 or 3. So it's a lot of people that you have the luxury, the honor, and the responsibility for thinking about their total financial well-being. Because remember, I was in charge of global benefits, so it's not just their healthcare; it's also their retirement, their disability, etc. So if you think about it from that perspective, I always tried to manage or think strategically around that. We have 2.5 million lives, each of whom are unique and different. Each of whom have a different objective, a different story, a different life. So I will never forget one of my first weeks there at Walmart, and we were talking about some kind of a plan design thing or an element. I don't remember what exactly it was, but they said, oh, well, something's going to happen. Something bad is going to happen. And I said, well, that's a 1 in a million chance. And they said, yes, that's exactly our point. We
You're
have
gonna have
that
two
many
of those
people.
on average.
It's going to happen twice for us. So thinking about all of those nuances like that really changes your perspective. I think then also for me personally, it was taking advantage of, and not saying that pejoratively, but more affirmatively around taking advantage of the fact that it is a platform for change,
Mm-hmm.
and how could we maximize that platform for change so that it's not just change for Walmart or Walmart employees, but change for the healthcare delivery system at large.
Mm-hmm.
And I think that's actually shared by a lot of other employers, because um, typically employer people like me in similar roles, when we do things at our employer, it's not because of some competitive decision. It's because we want to do the right thing for people, not just employees.
Mm-hmm. Talk to us about some of the biggest successes you had in your tenure at
Yeah.
Walmart.
Well, I, the biggest success was implementation of our centers of excellence. And I
Mm-hmm.
want to give huge credit and kudos to my team that worked with me there. Some of whom are still there. Lisa Woods, who I know is well known by many of your listeners.
Mm-hmm.
And also a lot of credit to Tom Emmerich, who preceded me with some of the early thoughts around centers of excellence. And then, we just kind of continue to build on that. But the team and I really began to focus on and identify that there is so much bad healthcare happening.
Mm-hmm.
And we always were struggling with how can we get people to the right care in their communities. And finally, we came to the conclusion that that's too big of a project. That's too big of a bite to take. Let's find the best in a few specific areas where we knew there was the biggest variation in cost and quality, and make a choice there. And so those centers of excellence that we designed, that the way we designed it was unique in that it had aligned incentives between the provider of the care and us at Walmart.
Yep.
We changed the paradigm. It wasn't just pay for performance, it was pay for assessment as well as
Mm-hmm.
performance. And to me, that unique difference is what I'm most proud of. That it wasn't just find the best person that can do it. It was find the best doctor at an amazing facility who is actually intellectually, emotionally, financially driven to make the right decision for the patient, regardless of whether it includes surgery or not.
I love that. Thank you so much. For all our listeners that maybe aren't as super familiar with centers of excellence, I know that space well because I have a great client, Carum Health, that does that at scale. But walk anyone who is listening and watching that isn't super familiar with that vernacular, walk them through like what a true centers of excellence platform means.
Yeah. Well, and it's interesting that you mentioned Carum, because they reached out to me when I was still at Walmart and they were in their infancy and said, "How are you doing that?" And I really shared how we were doing it, because
Yep.
back to my point about this isn't about creating something only for Walmart. And so I'm glad to see that they have kind of learned from what we were doing. Centers of Excellence is both the term has been around for a long time,
Mm-hmm.
and it was first used probably at many of the carriers like Blue Cross or United or Cigna, and they would identify what they said was their best hospital for a certain kind of either surgery or condition, and that's fine. Um, Typically, though, when we would pull the covers on that, it was usually the facility where they maybe had a unique or featured financial arrangement, as opposed to the clinical differentiators. There was some clinical differentiation, but it was always at the facility level.
Mm-hmm.
So that's full stop. That's what a center of excellence is. It's a facility that is deemed by some entity as being best at something. The difference that we created at Walmart, and we probably shouldn't have used this terminology because I think it masks an important feature. We use centers of excellence, and people think about a center as being an entire facility or even a health system.
Yep.
We actually found providers of excellence. We found the one doctor in a facility that was a very good facility, but the one doctor who was the best at what we were looking for. And if you look back at the history of what we did, we didn't set, people would think Cleveland Clinic is an amazing facility, and it is for heart conditions, but it's not it wasn't at the time, in our estimation, the best for every kind of procedure.
Yep.
So it's finding the right facility, the right doctor that is the best for particular surgery, procedure, condition.
Well, that's my health system. That's the one I go to. Hopefully as
Right.
rarely as possible. But it is always good to have it right in my backyard. What were the biggest challenges of managing benefits at such a huge scale and ensuring the well-being of such a diverse and vast workforce?
Yeah. So scale brings with it curses and privileges.
Yep.
So it is hard to change a huge battleship. I mean, that's a classic consideration, and you don't have to even be that big to be hard to change. So just the systems. We also would some of our the early things we did, which were things like we were one of the earliest adopters of what was then known as Grand Rounds or
Yep. Included health.
Doctor on Demand, both of which are now part of Included Health. When you're that big, you can overwhelm a provider or a solution. So being that big, you would have to be very thoughtful, and you couldn't always move as quickly as you wanted to. On the other hand, being that big did give us the scale to do the centers of excellence and the direct contracting that we wanted to do, because we also did those as direct contract. We didn't use the carriers for those centers of excellence. We did a direct contract. We also did direct contracting for ACO. So that gave us some, that was tailwinds for us. The headwinds though were, it was just always complicated, and being so Walmart, like some other employers, but Walmart is literally in every zip code in the country, and in at the time 20 something countries. Now certainly we didn't do the same things in every country, but if you even just think about the US, every
Yep.
zip code, many of which are rural. So communicating with that many people that are hourly workers that are not behind a computer all day, those were the biggest challenges with working within Walmart and within such a big employer.
So you mentioned,
and I will also tell you the other one. I'm just going to mention this one other thing. And again, it's one of those curses and privileges. Whatever Walmart does is followed by media, by other employers. So yeah, it was a big shock to me, even when I went to Walmart, that the financial analysts followed what we did in our benefits programs. I mean, that is not normal. That is not normal. But when you're that big and you're managing a budget that enormous, and it's such a big part of the cost of doing business, it just makes it just much more challenging.
well, you did an amazing job. So you mentioned creating the centers of excellence model within the company. You did bring in, at the time, Grand Rounds, which became Included Health. Same thing with Doctor on Demand. What are some other programs and solutions that you brought into the fold during your tenure that ended up being great benefits for the employee base?
Yeah. Castlight, which now doesn't exist as the name Castlight anymore. So going back to strategic intent, our belief was that at the time that consumers didn't have enough information on which to make wise decisions.
Yeah.
And we were, that's another one of those early adopters to bringing in Castlight so that patients would have more information about the cost differences. But we also, because we were such an early adopter with Castlight, as we were with the others, we were able to influence how Castlight had developed their program. So I'll never forget talking to Gio and Seth, the founders of Castlight back in the day. We're like, you need to include quality indicators in this as well. Said, use Leapfrog. Just start somewhere and add quality. And so that those concepts, we could start young or early with an innovator and that we see that is solving a strategic goal for us, which in this case was transparency or information for the consumer, and then continue to influence it to develop it to meet more strategic objectives. So I would say those in those early days, those were the big three that we really focused on, and then we kind of transitioned more into development of where we couldn't find a solution, which was the centers of excellence, because CAREM didn't exist at the time. Centers of excellence, direct contracting with ACOs, we did that, on our own. But I would say Castlight, Grand Rounds, Doctor on Demand were the big three in the early days and then once we began with them, we continued to iterate with them on development of making them even better, which I know Lisa has had a lot of success recently on really continuing to just develop those and make them even more valuable for Walmart associates.
Yeah, I'd love to have Lisa on at some point. I remember her and Owen Tripp from Grand Rounds at the time. I remember them presenting at Conference Board several years ago, and yeah, she was great. So I think she brings some great perspective, and can educate us on what's been going on at Walmart since you've moved on to other things. So walk us through. With over 30 years of experience, you've witnessed significant changes within this, healthcare system and industry. How have you seen innovation shape the landscape in the payer and employer solutions from the time you kind of started in this space to what we now see?
Well, so there's two things. One, well, maybe three things, but the two things that I would say is, so if you think back to even in the 90s, yeah, I guess it would have been the 90s when we saw the early development of organizations like what were called then Definity and Luminos, which when I was at Wells Fargo, we implemented Definity, which now both of them have been bought, subsequently been bought. I think Definity was bought by United and Luminos was bought by someone else. But those were the very, very first consumer-directed health plans. So getting back to your question, which is what caused kind of that explosion of innovation? So I think one was there were employers that were starting to become dissatisfied with what the classic health plan delivery system was at the time. And number two, it really was just that unique set of external factors where Silicon Valley exploding with innovation in so many different areas and venture money being available to support that development. I think that it was that confluence of situations or confluence of experiences that enabled the explosion. So it was number one, employers really experiencing and stressing, this is not working for us. And number two, venture money there were a few innovators that were able to hear that, see that, the Owen Tripps, the Geos, those guys. And then there was venture funding available to light a match under it.
So you've run large teams at Wells Fargo and at Walmart. What advice would you give benefits leaders who are trying to just do best by their employees with limited time, limited resources?
So let me parse that question. So you're not talking about taking care of your staff, right? That's working for you. Are you talking
We're talking about
about
like the entire population.
the entire population. So I'm going to get up on a soapbox here for just a minute.
Please
And
do.
I would say two things. Number one, don't let perfection be the enemy of good.
Mm-hmm.
And number two, which is the subset of this, which is just try something, for goodness sake. So we get employee benefits leaders are way, I'm being very pejorative here, are way too cautious. And the reality is that if I had never tried when I was at Wells Fargo and a couple of my other colleagues, they're the organizations, I think about almost every day, Sean Levitt at Comcast, rest his soul, from Comcast,
Mm-hmm.
and Safeway before that, and Carlson before that, right? That if we hadn't tried Definity or Luminos, consumer-directed healthcare would have never happened. Now, I will say that I have some regrets about that because I think it spun off in some bad directions. But if we hadn't tried Grand Rounds, expert medical opinion would have died on the vine. But somebody has to try these things first. So try something. What is the one thing that you can see in your claims, in your data? What is happening in your population? Are your employees, is maternity a big problem? And so if that's the case, is there a solution that's going to help with the fact that members are getting C-sections too many times,
Mm-hmm.
right? What are you going to do to help with that? Or is it cardiac because you have an older problem? Figure out what your problems are and pick one and just start and find a solution, or create a solution, or find others like-minded with you and try to. So I get on the soapbox and I get excited. But the most important message that I would give to any benefits leader is try something.
Yeah.
Don't just wait back and wait for somebody else to magically fix the world.
That's similar to what Jason Perot said on this podcast, similar to what Nathan Count said on this podcast. So I really appreciate, that thought process. And you said something very telling. You mentioned that a lot of benefits leaders are cautious, and very conservative, and probably not super, open to change unless like feeling compelled to do so. I guess my question to you is, how can companies incentivize benefits leaders to be a little bit more risk tolerant?
Well, the old adage, nobody ever got fired for putting in IBM,
Yep.
right? So if a company can support a culture that allows benefits leaders to take cautious risks. I mean, don't want to do stupid. I mean, don't be stupid, right?
Mm-hmm.
I mean, be thoughtful. So if a workforce for workplace, an employer has a culture that allows individuals to take a few risks that are modifiable, that are measurable, but not such that they can't be fixed, right?
Mm-hmm.
But if the culture allows that, that's the best thing that can happen, right? I will tell you that not every recommendation that I took to our board for implementation has got the check mark,
Mm-hmm.
but most of them did, because we were thoughtful about stepping into it in a stepwise fashion.
That's great. Usually when people ask me like, all right, how do I incentivize an employee to do this? How can we retain them? How can we make sure they stay? We love them. We want to keep them happy. Usually it's promotion and raises and, bonus them based on the activity you want them to do. Is there like a possibility at some point in the future that some of these companies say, hey, if you are able to curb the spend or even reduce the spend, like we'll bonus you like as a benefits leader? Like I'm just wondering, how aggressive can these large companies get to really incentivize people to take risks?
So I only know of one person in one prior life that was ever able to negotiate that into their contract.
Mm-hmm.
And he did very well by being able to get credit for reducing healthcare spend.
Mm-hmm.
Um, I mean, I think it would be an incredible offer if an employer made that to a benefits leader. Um, I think it would be incredibly difficult to measure.
Yeah.
Because there can be so many confounders. And it's just like, which is actually, quite frankly, one of the challenges with all of these things. I say, just try it and then measure it.
Yeah.
The problem is that measuring any of these things that we did has so many confounders.
Yeah, in a
So,
year,
one
it's a
of the
small
other things
sample
that I was
size. So even if in your
small,
1 in a million example, let's say you had 5 of those occurrences in a year, no matter how
yeah,
well you did, 5 as opposed to 2 is probably going to change the numbers. And that's just
yeah,
luck of the draw. But when you maybe extrapolate it over a longer period of time,
yeah. I mean,
yep.
even different weather, right? I mean, it was a bad weather year. It was the company as a whole did poorly, and so there was a lot of employee turnover, or so many things that can
Mhm.
change the actual mathematics of it. I do want to mention one other thing though, as I was thinking about things that we did at Walmart. And again, this is a call out to my colleague there that worked on my team, David Hoke. Um, and we were also, because if you think about managing healthcare costs, everyone always goes, oh, if everybody's healthier, right? Healthcare costs we manage. Well,
Mhm.
generally at the highest level, generally true. But it's a hard sell at every employer to get the budget quote to implement a wellness program, which was for sure the case at Walmart, but they wanted something. And
Mhm.
so we developed a solution that actually cost almost no money, but it took advantage of all of the right scientific approaches around behavioral economics, around nudge management, around tiny changes. We used BJ Fogg, we used Kevin Volk, we used all kinds of scientific research about what are the things that will cause people to make changes in their life.
Mhm.
And we created a very, very, very inexpensive way. And it turns out that it's all about how do you helping people figure out what their motivator is, and then giving them a methodology for tracking and making those changes. And it's about what did I do different today than yesterday, and celebrate that. And then tell your story, because people follow people. And that's actually what also helped support our Centers of Excellence program.
Mhm.
Once we had a few success stories that had some unusual outcomes, sharing those stories, because people follow people. They're not gonna listen to Sally up there ranting, some video that they were forced to watch for annual enrollment, right?
Yeah.
They're gonna say, oh, my friend at store, 3725, this is what they did.
Yeah, I love that. I just think, just back slightly to the topic of incentives for benefits leaders. I think, when the worst case scenario is I get fired and I have to find a new job, and the best case scenario is, hey, nice pat on the back, but no promotion, no raise, no bonus. That's just putting someone in a situation where there's no advantage to taking risk. So I think,
Yeah.
part of
No,
the challenge is the situation some of these companies put their benefits leaders and their benefits teams in. And I think, that needs to change to just enable even more innovation going forward.
yeah. I mean, I think it's, for benefits people is, it is a challenge, because usually you're part of like a total rewards and you're part of HR.
Mm-hmm.
And compensation, a lot of times total rewards is compensation, and benefits. Compensation is so different from benefits. And, I have personal opinions about why, theoretically it's all part of total rewards, but it actually isn't. I mean, nobody ever says, oh, we're going to pay less so they can get more benefits. I mean, that just doesn't happen. Um, but the skill set of benefits leaders is very different than the skill set of a compensation leader.
Mm-hmm.
So from a benefits leader perspective, from a career perspective, um, you're right. That is sort of the risk of that career, which is topping out at the top of the role within an employer. And then it becomes a much more intrinsically driven satisfaction
Mm-hmm.
than it is the extrinsics of it.
Yep. Really insightful. You've sat through hundreds, if not thousands, of vendor pitches over the years. What advice would you give a founder that is going into a meeting with a benefits leader that might be, newer to this space?
Yeah. I think the most important thing that so I would say two very, very important pieces of advice. Number one, think about what is a problem that your audience, your prospect, is trying to solve.
Mm-hmm.
Not what is the problem in the world at large, but what is the problem your customer is trying to solve.
Mm-hmm.
So if you think about it, I'm going to use an example of diabetes, right? Everyone knows that America needs to solve the diabetes problem, right? So if you say, we are here because we are going to solve diabetes for you, Miss Employer. Well, no, my problem is that I've got people all over the country some of whom are not, at a computer, or my problem is that I've got this kind of an ecosystem, or my problem is, what is the problem that the person you're selling to is trying to solve, not what is the end result of your solution. So I think that's the first one.
Mm-hmm.
So think about it, your pitch from who is going to actually buy it, not from what the end user is going to do. The second thing is every solution should be able to tell their story succinctly and literally. My analogy is an elevator pitch at the Courtyard Marriott means it's no more than 3 floors high, right?
Mm-hmm.
So if you can't tell your elevator pitch in 3 floors, then it's too long. Figure out how to succinctly say what you do, why you're so special, why you're better than everybody else in that category, and you're going to deliver outcomes. It sounds like, oh my God, how can you say that in literally 3 sentences? It can be done.
Oh yeah.
And usually it's really, really hard for the innovator because they're in the midst of it and they go, oh, we do this, we do that, we do this, and that. Step away from it. And it's the cocktail party, like, what do you do? What is the 2-sentence cocktail party? And the only caveat there, I would say, it's a cocktail party of sophisticated purchasers.
Mm-hmm.
So put that caveat on there. But if you can't tell your story, and if you don't put that the very first thing in your presentation, you've lost me.
Yeah.
I'm like, get on with it.
Yeah. I still remember where I was sitting, what I was doing, everything, like all my surroundings when I heard Hinges for the first time. When I met Dan and Gabriel at Hinge, and when they told me their value prop, I'm like, I'm looking a unicorn straight in the face. We just got to execute. So that was, I always try to set every meeting I ever have when I meet a new company to that gold standard. I'm like, all right, how's their pitch compared to what they did in the very early years? So that's really, really good advice. What else would you just guide a founder of a company in this space that's maybe doing it for the first time? I think there's a lot of great multiple time founders, but there's a lot of people who are entering this space just because, number one, they see the success. Number two, a lot of times it's a passion project. And number three, the space just is a lot of passion, and it has a lot of, like a good example is Lyra, right? Like David was over at Facebook. He probably didn't need to continue to work, but if he was going to continue to work, he wanted to do something he was really, passionate about. And he founded Lyra. Now, that's an ultra successful company. So you see a lot of people who have been successful in other markets and kind of validated their careers. And then it's like, okay, I'm going to do this passion project as my next thing. And that's, how some people enter this space. What advice would you give some people that are just starting out on that journey?
So it comes back a little bit to what I was saying earlier, which is understanding the customer. So EHIR offers an academy program, which I think you're familiar with.
Yeah.
And it's so common that you will have someone that has a great idea typically in a clinical category. But they do not understand what it would mean to actually sell to an employer. All they know is oh my goodness, if I can get employers to pay for this, I'm gonna, I'm gonna make it rich. Well, or I'm
Mm-hmm.
gonna succeed. Maybe not financially, but I'm gonna succeed.
Yeah.
And the reality is, most of them, I've seen this happen many times. They have no idea what the word ERISA means, or the acronym ERISA means. And if you
Mm-hmm.
don't understand what that means, then you don't have any business being in the employer space. Or until you learn that,
Mm-hmm.
you don't understand what it means to be in an employer's ecosystem. When I asked about, well, how are you integrated with their health plan? Oh, I have to do that. Oh, what have you done about getting your SOC 2 certificate? What do you, is that important? So really, if you are starting out, because particularly those, as you said, the passion projects, they've had a family member that was struck with some horrible disease, and we're going to fix this.
Mm-hmm.
That's great. Fix that, figure out what you're going to do. But before you start trying to sell onto employers, do your due diligence on understanding how employers' world really is.
Yeah, that's fantastic. As executive director of advisory services, you advise innovators and entrepreneurs on, the development of digital health products. Kind of walk us through how your expertise over the last bunch of decades helps you really, get these companies focused in the direction they need to go to make sure that, they're not spinning their wheels.
One of the first things that I encourage them to do is look at the competitive landscape. I think that this wasn't true 15 years ago. The competitive landscape was not competitive. There were unique solutions, but I think there is a lack of understanding of what else is out there, and maybe a lack of appreciation about the relative magnitude of difference that has to happen in order to differentiate. And then secondarily, how quickly so it goes both ways. One is how quickly an existing innovator in your category can modify and be doing exactly what you think you're doing that's so unique, or the reverse, which is how quickly you can overtake an existing innovator that isn't evolving quickly enough.
Yep, that's great. What do you think the most pressing challenges are that benefits leaders are, encountering today?
So, very tactically, today, 2023, it is healthcare costs. It's about the costs. I would say personally that I have always said that was the problem. We took our eye, we being benefits leaders,
Mm-hmm.
took their eye off of that ball during the COVID years, even before that,
Mm-hmm.
where it became more about it was a much tighter labor market. It was about what can we do to nice benefits for our employees. But if the employer isn't focused always and continually on the overall total cost of care,
Mm-hmm.
then they're not focusing on the right, in my opinion, not focusing on the right thing. And so when you ask me what should they be thinking about, I think they should, and what are they concerned about right now? Because a lot of other influencers, they're back on and thinking about total cost of care. I would augment that, though, to say this isn't about prices.
Mm-hmm.
It's not even about utilization. It's about coming back to what is the appropriate care? Who should that, an appropriate meaning, is the care even necessary?
Mm-hmm.
Is it overutilization? Is it inappropriate care? Is it incorrect diagnosis? Is it the
Mm-hmm.
incorrect treatment plan? So when employers are worried about costs right now, and they come at it from different angles, but it always should come back to thinking about it from an healthcare perspective around all of those elements around utilization, also price. But truthfully, I mean, I've always said I can pay you twice what I pay you today if you will just manage utilization and appropriateness.
Yeah, I love
Anyway,
that.
I'm not sure that exactly answered your question, because you asked what are employers worried about, and that's what they're worried about today. I would say that the secondary thing that they continue, this has been for 5 years, they're continually concerned about the mental health support for their staff.
I'm a big proponent of not seeking but supplying the appropriate level of care for a member. Like if you're able to do that, you're able to create efficiencies. And right now the healthcare system as a whole is pretty inefficient at the moment. So anything that like has that angle is really important. As usual, high quality, low cost. Everyone, tries to do that. But I think getting people to the appropriate level of care at the right time, can achieve those things just by accident. So, in terms of like areas that are kind of new to the market that you're really excited about, just curious of things you've seen in the last handful of years that you're really bullish on. Do you think, hey, there's been some innovation in these spaces, and I think that's going to do a lot for employers that focus on it?
So I'm going to talk out of both sides of my mouth here for a second. So I'm being self-aware. And the area that I think has not, that is coming up, that I think is transformative, is the focus on root cause, and which is very tied to some of the autoimmune conditions, or to all autoimmune conditions. And I think I'm seeing it more and more from a few innovators around thinking about what is the root cause for symptoms,
Mm-hmm.
where the symptoms might be something like infertility, or the symptom might be something like psoriasis, right? Those seem like, so if you come at it from a classic perspective, someone's going to treat infertility, right? They're going to treat infertility the way you treat infertility. They're going to treat psoriasis the way they treat psoriasis. But what's exciting is
Mm-hmm.
now, exciting to me, is that there are few companies and few people starting to look at what is the root cause of the infertility. It may not be that we need to just solve for the infertility, we need to solve for something else. And to me, that's the most intriguing, really transformative thing within healthcare,
Mm-hmm.
which isn't about just treating. It's not about healthcare. It's actually about identifying the causes of problems for us.
That's great. I really like that. Anything that's not being addressed yet that you're just hoping a company steps up and attacks and, builds a solution that, really helps something that really has been untapped.
I don't have a good answer for that. People ask me that all the time. I mean, for a while, for several years, I said cancer. I think that has been more fully solved for by the likes of, Memorial Sloan Kettering, Access Hope, Mayo, et cetera,
Mm-hmm.
followed on with a lot of the other kind of probes with it. Um, like I said, I think this root cause thing, I think autoimmune is an area, but, tied with that root cause. I don't have a good answer for where the gap is today.
Well, maybe if you had it, you would have started a company around it. So
Yeah, I know I'm not an entrepreneur. I'm a benefits leader. I can help figure out, but I'm not an entrepreneur.
I love that. Very, very good. What advice would you give someone who's thinking about, being a benefits leader? What are the great things about it? What are the things someone might want to think twice about?
Yeah. So the great things about it are the opportunity to actually do something. So there's four things here. So the most important part is the opportunity to do something that can influence not just the company you work for, but a much, much, much bigger population. You can influence
Mm-hmm.
something that could impact all of America. And that's true not just within health benefits, but also within retirement benefits. Thinking back to the years of the first cash balance plans and the first 401k plans, those benefits leaders influenced something that
Mm-hmm.
became standard de rigueur now, right? So it is that ability to have a far outsized impact. That's the first thing. The second thing I would say that is really wonderful about employee benefits is that it's complicated. there is public policy. I mean, we don't ever talk about on, podcasts like this, the regulations and the laws and the legislation at the federal level and at the local level. I mean, I've spent lots and lots of time in Washington, D.C., trying to influence the legislation. The economics, the fact that this is actually a part of an economic, not just financial, but economic influencers, right? It's got accounting. I mean, nobody talks about FASB anymore, but the FASB reporting for Medicare and for retirees is extremely fast. I mean, I think it's fascinating. So it is so multifactorial, and it changes every single day. There's a new law, there's a new regulation, there's a new innovation, there's a new way of thinking about things. There are new ways that people want to gather information. There are new ways that people think about their health. It's just so dynamic. I've always thought it was. That's why I stayed in my entire career in different ways, shapes, or forms, not entirely always in the same kind of way. I would say the hard part, though, is it is complicated. So you have to spend a lot of time spend a lot of time learning, Never, you have to learn just so much, take in information from so many different areas. It is it is difficult because it gets scrutiny, and it is often managed differently in every different organization. We were talking about that a minute ago, around everything that you think should be done is not necessarily what gets approved. It's difficult, we said, from a career perspective. You kind of hit a, top of the ladder, and like, where do I go from here, kind of thing. All in all, obviously, I would say it's an amazing career.
Yeah. Well, I think something we've hopefully agreed on in this podcast is we're going to be the two to start the goal of having incentive comp for benefits leaders that take risk.
I like it.
We're going to campaign for it. We're going to try to make that the normal thing for health and benefits leaders to have as part of their comp plan. If they bring in something that has a lot of success, they're rewarded for it. And I think that can really, help us move this thing forward. I always ask everyone who comes onto this podcast, how do you practice what you preach? So, you've been in stressful jobs, you advise a lot of companies, you're involved in a lot of, organizations nationally. Like, how do you stay, mentally fit and physically fit to be able to, perform at your best all the time? What are some exercise routines that keep you sharp?
Yeah. So I think two things. One is getting outside. I mean, I really think the outdoors is for mental as well as physical is really important. And the second thing is for me personally, everybody has to find their own thing. For me personally, it's being outdoors hiking. I mean, that's just, or even just outdoors walking, but it allows you to emotionally decompress. I mean, I remember at Walmart, I would come home, and no matter, literally every day of the week, rain, shine, snow, my husband and I would take a 20-minute walk with the dog, and it's that 20 minutes to decompress, share what's going on. The dog is excited, you're excited, and you can, then you can shift to, okay, now I'm at home and I'm doing something different.
Yep.
But that to me is the whole, that to me is a very important piece of it. But everybody's different. Everybody has their own.
I love that. Yeah, my dog's always excited when I come home. So that is like the best confidence boost. Until I had my daughter, and then when I get home and she's excited, that's even a little bit better. But it's always good to have someone excited when you come home. And then any healthy recipes that you make at home that are typical go-tos for a quick, healthy family dinner that helps you just feeling your best and performing your best.
Every dinner I make is healthy.
That's good.
Yeah, I mean, you know what? We do eat at home virtually almost every night of the week, and I do prepare a meal every night of the week. And I always said that having a healthy dinner with your family is the most important thing from a family dynamic, as well as physical dynamic. But it always includes a lean, generally includes a lean protein, some vegetables and maybe a starch or two. But my go-to, if it's a healthy dinner, is you're going to get some salmon, throw it on the grill, a little salt and pepper, a little bit of olive oil, a quick, I people are shocked at this, but I microwave get some fresh asparagus or fresh broccolini or broccoli, microwave that for 3 minutes and a little bit of steam, and you're done. Maybe you do a little bit of rice or something on the side. That's my go-to if it's the healthy dinner.
That sounds
Not a
great.
recipe, just an approach.
I love that. Well, again, Sally, really appreciate you coming onto the podcast and joining me, stepping into the ring for the digital health heavyweights. And again, I know all our listeners and viewers are really appreciative of you being on. Again, Sally Welborn, and thank you for joining us on the podcast.
It was my pleasure and honor. Thank you so much, Ben.
Appreciate it, Sally. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.